Welcome to Stage Free, the podcast where we have real conversations about what happens after a diagnosis, because survivorship is more than just surviving, it's about living. I am so honored to be your host, Loriana Hernandez Aldama. I'm a journalist, I'm a two-time cancer survivor, and passionate advocate and founder of Armor Up for Life, where we have Stage Free. So today's topic about mental health is so close to my heart because I have the PTSD and the depression and the anxiety after battling AML leukemia, being separated from my then 2-year-old son for a year, and then breast cancer. So I've been open about my own struggles, but the other reason is I think it's so important we need to have these conversations to let everyone know it's okay not to be okay, and that we need our healthcare system to help us out, that we need this fighting cancer is not just a physical fight, it's mental as well, it's financial, there's so many layers. So if you're listening and you're quietly struggling, I want you to know you are not alone. So we hosted the webinar, It's Okay Not to Be Okay. So if you're coming here from that, welcome. If you're new, welcome too. But it had an outpouring of honest, raw questions from survivors, caregivers, loved ones. And we couldn't get to all of them live today. So we're picking up where we left off. We're going to have rapid fire with the amazing Dr. Stephanie Ross. She is a clinical health psychologist with more than 25 years of experience supporting patients and families through emotional and practical demands of cancer, from coping with the diagnosis to parenting through treatment and navigating survivorship. Dr. Ross has seen it all. So she's also a fierce advocate, which thank you for being an emotionally informed care psychologist. You focus on patient-centered care, and you also teach at Northwestern University Feinberg School of Medicine. Dr. Ross, thank you for joining me, and welcome to Stage Free.
Thank you, Loriana, for inviting me to be with you today.
I'm so excited to have you. We had so many questions on the webinar we could not get to. Before we get to all the rapid fire questions for everybody joining, the theme is it's okay not to be okay. And when I talked to you about this, you were like, I want to make it very clear to survivors, this is not a mental health disorder. It's a human response. Can you help us reframe the emotional toll of cancer in a way that feels validating instead of stigmatizing?
An analogy that I've often used when talking to people who are recently diagnosed or when they're struggling is this. When someone is diagnosed with cancer, it is similar to being told, often over email or from a MyChart message, that you are about to embark on a lifelong trip that you had not planned, to a destination you never wanted to go, had no guidebook, and only a very generic itinerary filled with we really don't know yet, and it could be very dangerous, including a chance of death or disfigurement. And then you are informed that your flight leaves tomorrow morning, and that after this initial journey that may last an indefinite amount of time and will probably change most aspects of your life, you will probably return home, but should know that another trip at some other time, but we cannot predict if or when, may be planned for you at any time in the future. There may never be another trip, but it's not a non-zero chance.
That is the perfect way to put it. Yeah, like we don't know. You might have another trip. You may not. We have so many questions that were submitted. So let's dive in. The first one is, I've had depression for years, taking medication, and was wondering if you have any suggestions or tips for combating additional depression due to breast cancer.
I think that because depression, anxiety are so common, many people who are already suffering through or being treated for depression and anxiety have cancer as an additional stressor placed on top of that. So oftentimes it's the cancer-specific interventions that help the most, perhaps a support group, perhaps finding an individual therapist with some understanding of cancer and how things can go with your health journey. Also, there are many medications. If you are taking medication for depression, speak with your psychiatrist or find a psychiatrist who knows about medications that can be helpful for even treating or mitigating some of the symptoms that are associated with cancer treatment, such as insomnia or sweating or things of that type.
Well, you hear things like, oh, if you don't get enough sleep, then it causes stress to the body. Stress can lay the groundwork for inflammation. And so you're like, oh my gosh, I have to sleep. I don't want a recurrence. I want to do everything right. But then you get put on meds that don't help you sleep.
Correct.
But then think you're saying it's okay to say to your therapist, I need some sort of medication, like some kind of thing to help me go to sleep. Whether
Or an evaluation, might it be helpful? And perhaps you're taking a medication, but it's not helpful to you in this situation because of the bodily changes that happen. So it's also okay if you have a long-standing relationship. And I see many of these patients who have a long-standing relationship with a beloved and very helpful therapist. And seeing someone in addition or for consultation to who is informed about health-related conditions and cancer can really help as well. So support groups, cancer-specific health intervention therapies can really augment the care that you're already getting.
okay, and I have so many questions. I have them coming in on my email, coming in on my phone. Here's another question. I have small kids and not the best support system. I choose not to tell my family members. I have never felt so lonely. How do I not scare my kids, but at the same time say I am not okay?
That's a pretty tough
It-
question.
Yeah. I
And
mean, when I was separated from my son, and he would say, "Are you going to be back?" I'm like, the truth is, I don't know. Like I was in the hospital separated. So how do you, like this person says, how do I not scare my kids, but at the same time say I'm not okay?
I think it's really important based on the age and maturity of your children. And it may be different for each of your children because you could have a very young child and an older child to develop mentally appropriate tools for speaking to them about cancer. And these do exist, and I'm happy to provide some resources at the end of our podcast. There are experts who can guide you through it. There are books. In my practice, we have a child life specialist who's specifically trained to speak to kids in language that they do understand. What is important is that if you are going to tell anyone and your kids are of a verbal age, that they probably need to hear the news from you because there's a very high chance that they will hear it somewhere else. If you've told anyone, and even if you said not to share it, it happens all the time. You will tell someone and they will be speaking on Bluetooth in their car about, to their spouse about it. And some kid in the third row knows and tells your child on the playground. We need to be the primary support person for our kids. The other thing I will mention is that it's important to parent through cancer, and that sometimes takes a village and needing the support and help to do that because kids rely on routine and they rely on structure. And oftentimes when a parent tells a child that they have, cancer and they're going to have a lot of appointments, the first response out of a child, and it's very typical, is who's going to drive me to school?
Right.
Can I see
a pit crew?
now?
I had someone walk the dog, someone take my son places. Well, I was in the hospital for a year with leukemia, but then with breast cancer, I had so many appointments. There was no routine.
Correct. And routine is so critical for kids. And it often gets by the wayside because cancer and its treatment is so disruptive to daily life.
So would you say, I mean, I'm not a therapist. I'm definitely I don't want to put the crown on like that you've earned, but I would say I had to be vulnerable and build what I call a pit crew. And the pit crew, I say, is not everyone with the same skill set, kind of like they do at church. Like if you're good with dogs, I'm going to give you my dog to walk every day. If you're good with kids, if you're good with driving, if you're good with cooking. And I started to have to like assign people and say, here's the list of what I need. And I need everyone to successfully get me to the finish line with different jobs and different tasks so I could have some normalcy for my family. But I had to say when they were like, oh, let me know if you need anything, I had to flip the script and say, here's what I need. And not everybody can do that. But if you can, I encourage, it was helpful for me. It was the only way I got through it.
And I suspect it was also helpful for your support circle to feel useful in a way where people often feel very helpless. What can I do for you? You're in the hospital. I can't solve your pain, but I can do this for you. And it includes them in your journey. And
yeah. Well, I think I had no problem after a while. Now, at this point, after 2 cancers, if I need any help, I just pick up the phone. I'll ask for anything. They know it.
You probably anticipate the needs of others.
Yes. Now I'm always, if
No.
someone asks me for help, I'm there. What way? Or I tell them, here's how I'm going to help. Um, Another question coming in on my phone. Again, they're coming in from everywhere. This person says, my coworkers think that I'm being vain for going through revision surgeries. They ask me, why do you put yourself through multiple surgeries when it takes a toll on your body? And why did I just go flat? Maybe she means, why didn't I, if I'm going through surgeries? How do I tell them without being harsh that this is my decision? And it's our coworkers.
It doesn't matter if it's your coworkers or it's your kid or it's your tennis partner. This is a very personal decision. And oftentimes it's one that no one can understand unless they've been there. And so finding a polite way to set a boundary, it's very interesting when somebody gets ill, normal boundaries and things that you would never ask someone about somehow dissipate. And we invite ourselves into another person's lives and become nosy in ways that are not supportive and that we probably would never act in that way should the person not have cancer. And so I think it's really important to say in a gentle way, I don't feel the need to justify my decisions. It's my decision. And if you'd like to know how you can support me through this, I welcome you to.
Well, and I think when you're talking coworkers, they might be a little judgy. Haven't talked to this person of like, oh, this person needs time off work again because she wants a revision surgery.
And
Like,
exactly.
I remember when someone told me it was a mommy makeover. I'm like, listen, I look worse than when I started. I look pregnant from the scar tissue. So let's not even go to mommy makeover. But I'm guessing if this person mentioned coworkers, that people are like, oh, look at Samantha or Loriana. She needs time off work again.
And I suspect you're very correct in terms of, I always say people who don't understand and haven't been in the fire very close to it don't understand that it's not a one and done. Even patients don't understand this. Patients who are going through mastectomies and reconstruction, oftentimes we really have to educate this. May take a lot of revision, and it's really the general public does not know that. And it also speaks to the difference when people say things who are uninformed, like, oh, well, you're getting a boob job.
Right. Oh, come talk to me again. Let me have a conversation with you, please.
And, at least you're getting new boobs, or,
Yeah.
at least they're perky, or you won't have to wear a bra again. This is not an elective procedure.
Yeah. And until they walk in our shoes.
Correct.
Any tips? I'm going to keep going because so many people want your advice. Any tips on how to handle people making dismissive comments? And this leads from this one. This is a different person though, or minimizing what we're going through.
I think everyone has to come to an elevator speech of sorts in terms of, doesn't have to be detailed, and it can be as detailed as you want it to be. Of, this is what I'm going through. These are the various parts of it. This is my journey right now, and you can get on board with me or not get on board with me. I feel that a lot of people do want to healthy people who haven't been touched by this disease or other illnesses, want to put as much distance between themselves and the sick person as possible. And a lot of times people will minimize what you're going through because statistically they do have a chance of getting breast cancer.
Yeah, I tell them, you don't want my story to be your story. Be careful what you say.
And they also need to know. So when people minimize it, they are in some way in their head creating a narrative. Well, if this happens to me, it's not really that bad.
I didn't think of it that way. There are people who have minimized, like, okay, well, you've got to carry on. I could you worry about this. I could get hit by a truck tomorrow. I'm like, okay, let's not go into who can get hit by a truck and who can go have cancer again. I have to just breathe deeply and move on from that conversation. Speaking of moving on, because I could talk about this forever, here's another one. How do you stay positive and start living life rather than just existing? How do I get to the point of trusting the doctors that I am cancer free? And I understand this. I have a rotator cuff tear from things, and I'm like, are you sure can you recheck it? So there are a lot of patients who align with what this person's saying. How do they trust the doctors that they're cancer free and stop worrying and start not just existing, but living life to the fullest?
I think that being 100% worry free is unachievable, first of all. So it becomes a question of how do you manage that worry? It's going to exist. It would be unnatural not to. And if people don't worry, it's also dangerous not to worry at all, because then they're not, oftentimes not taking care of themselves in the way that they need to. So a little bit of anxiety goes a long way. Not clinical anxiety, that's uprooting your whole life, but a little bit of worry is the thing that keeps us doing the things we need to do for health maintenance. So, having a little bit of worry will keep you doing the exercises that you might need to do, or making sure you have routine follow-up, or making sure you take your medications every day, and making sure that you maintain other health
Is it
beliefs.
to make sure you check off all the things you're doing to protect yourself? This way you can say, I did everything I can and the rest is out of my control. And also
Partly that.
relaying this to your doctors, like being open with your doctors, like, hey, I know you're a nice person, Dr. Ross, but I don't trust the results you're giving me because I'm scared.
And also, a good doctor will always extend an invitation for you to get a second opinion. Oftentimes that is really helpful to hear it from two professionals, not just one. And it can go a long way, especially when people haven't had a second opinion right off the bat at time of diagnosis. If the cancer does come back, they will often blame themselves. Why did I only get one opinion? So if it is that pervasive, that is one, very obvious thing that you can do. But the worry and about how to minimize the worry once you've established that you trust the doctor, but nothing is 100%, is something that you can work on in therapy. There are a lot of techniques that are really helpful, including self-talk, including some cognitive behavioral skills, things that we can give people to stop the worry.
You can put some of this in the resources section of our show notes, so we can give that. I always say, I found out about my diagnosis after a second opinion. So I say, always get a second opinion, even if you like the first.
Yes.
And so I believe in the second opinion. I think it's good. And I still love my doctors. The next question, I did better during treatment. I felt in control for 3 years, double mastectomy in 2013. It's now 10 years post-treatment that I feel out of control and I struggle. She says, I cannot get fear out of my daily life. People think I'm so strong, yet I collapse in private. Every day I live like it could be my last. It's every single day. I feel this to my core.
Yeah. I'm sorry to hear that, because that sounds like an excessively uncomfortable amount of anxiety to have. Some anxiety following treatment is very, very normal. If anxiety becomes to a place where you feel that you're not functioning well, having it evaluated and perhaps treated can be helpful. But interestingly enough, there's a lot of research that shows if you look at when patients present with anxiety and depression, most common knowledge would, say that it's upon diagnosis. It's actually when treatment ends. Because during treatment, you are monitored very closely.
Yeah.
You constantly someone with eyes on you, with scans on you, with taking blood and monitoring you. And in that, you also have a built-in support system through your medical team. There's constant outreach, there's high touch, you have someone to call, somebody's asking, and the support around you from your family, from your community. And after you are out of treatment, all of that disappears. And a lot of my patients feel really unmoored by that. And the loss of that, especially with the, current sort of guidelines to call someone if anything changes, or if you feel something, if you have an ache or pain, or you have a lump or bump, call. And so that leaves people with a lot of self-monitoring, which is not necessarily good. We're telling them, monitor yourself, but just go on with your life.
Right. And so every little pain, you're like, oh, I have some bone pain. Could this be it? Or did I just work out too hard at the gym? And then you start to trying to normalize, am I not feeling right? Is this normal? And that's hard. And you were saying that the numbers show that people tend to have higher levels of depression and PTSD after treatment.
Yes.
How does that work for those who are metastatic where there's no after treatment? It's just as time goes on, their PTSD and anxiety gets worse as well.
Well, it's a chronic worry, and this is a real worry. This isn't, when you have metastatic disease, you know that, first of all, we call it now a chronic condition. It's not in right now, I'm not an oncologist, but people say you have metastatic disease, you learn to live with it. The goal is not to cure it. The goal is to, respond to treatment long enough until another treatment comes along.
Progression-free survival where it's not progressing and you're living with it.
Correct.
Well, on this topic, and you can answer these together, there's another one who says, with incurable metastatic breast cancer, it's hard to stay focused and positive when meds have side effects as well.
Absolutely.
Can you give advice? So can you wrap those two together?
Mm-hmm. So with metastatic disease, there's the constant worry because your disease has progressed. So you now have crossed over from the people who have not recurred into the statistically unfavorable group of when cancer comes back. So you are living not only with that fear, but you're living with daily treatments. And one of the things that I find really frequently now that there are so many oral treatments, if it's just a pill, it might not be seen as having side effects. Somehow, when you are going through chemotherapy and you lose your hair, having a pill, yes, it's easier, but a lot of these medications have profound side effects. So one thing that I often advise is some of them you don't have to live with, and there are actually management strategies for the side effects. So be proactive and ask about those. But it's also getting the people around you to understand. And that's very uncomfortable for people that you have something that's, quote, incurable.
Right. Because they don't fully understand the trauma and they don't know what to say about it. And speaking of that, the next person says, I can't talk to my family or friends about this anymore. There's no point. They want to help, but I just feel like I've been talking about it for too long.
And that's where support groups can be really helpful because they are people who do get it, especially for metastatic breast cancer. If you go to get and that's why we try not to we try to have more specific support groups, not just a general breast cancer support group, because it's not helpful to have somebody, who had pre-cancer and somebody who has, end stage cancer in the same group. It's not helpful.
I was in a group like that for my integrative oncologist, and she had people at all stages. I left more stressed than when I started because I was like, they would say, well, what if I need this? Because I left with so many what if who's going to happen to me that I spiraled.
And it's human nature to compare. So you sit in a group and you're checking out the person next to you and saying, well, I'm better than her, but I'm worse than him.
Right. So it is good to be in your group if you're triple negative or triple positive, if you're on your second surgery. And I know we partner with breastcancer.org here at Armor Up for Life for so much, and they have these great support groups like we've shared in the webinar. And to I would say, find your people, find your place, find your passion and purpose.
And it might take a while. Sometimes you have to kiss a lot of frogs until you find that.
Yeah.
There are support organizations that will match you up with a peer who's, gone through what you have gone through or has a similar challenge. And a lot of what's gained in support groups is not just emotional support, but it's actually practical support. So, I've had patients in support groups who are having terrible digestive issues from, a certain chemotherapeutic drug. And the best advice they got was from someone else in the group who was taking the same drug.
Right. And that's why even sometimes the Facebook groups, I'm on a Facebook group for breast cancer women who were on the same aromatase inhibitor for hormone positive breast cancer. we may have had different journeys, but when they say, hey, you know what, we've all had weight gain or we've all had this. When we go back to our doctors, when they're like, that's not a side effect, we're like, really? Because 55,000 women on this Facebook page sure say it is. Now, what are you going to say? So it does feel, you do feel validated when you see somebody else in the group say, yeah, I
Yes.
have bone pain too. I can't do this, but walking first or doing the yoga first. So it helps. I have to move on because you're going to tell me that I've kept you for way too long because everybody wants some answers. How do you stop yourself from seeing your body as diseased and deformed? Especially for those of us who you don't have nipples, you haven't been approved for tattoos, for the, how do you look in the mirror and be like, hey, I feel whole?
And that's a really common feeling. And again, I think culturally, people will say, none of that matters. You're just so lucky to be here.
Yes.
So lucky to be here. Who cares? And
Tell that to my husband.
yeah. And tell that to yourself every time you have to shop for a dress or every time that you are changing in a locker room at the health club.
Yeah. You don't want people to see you. I mean, like my husband's very supportive and I know people, husbands who are, but you feel like you've let them down. You're like, you didn't sign up for all of this. So the person says, how do you stop seeing yourself as diseased and deformed? What is your answer?
I think it's a gradual acceptance. And that's probably never accepted. It's like having a scar of any type. You wear it, it's visible, it's a reminder. It's a constant reminder. Even if you're having a great day, nothing hurts, you are, not living in cancer land at all that day. You're just doing regular. You can, go to try an address in the store. You can, and it's visible. And so it's not a failure. I think culturally, there's a lot of movement to just accept women however they are, but everyone has their own say in this matter. So where some people will say, oh, I love your bald head. Bald is beautiful, or, there's a lot of movement around being flat and that should be acceptable. It's not a one size fits all. And it's also not a failure if you don't take your shirt off. It doesn't mean a lot of women will feel a lot sexier in a camisole while they're being intimate. And that's okay. There's a loss there. But it is also okay to cover up. I worked with a patient. She never took her wig or her eyelashes off. It made her feel better. It wasn't that she didn't want to be seen like that. She just did not like to look at herself in the mirror. And she slept with her wig sometimes and her eyelashes. And that's okay. That doesn't mean you're doing it wrong.
Whatever makes you feel whole again. Or I don't know if I should say whole again because we're not going to feel whole again, but whatever, and it's okay. I remember a doctor looking at my lab results because I always see abnormal and I panic. And he's like, listen, what you've been through is not normal. Correct. So you're not going to always see normal. So Correct. Just get that first so you don't panic when you start seeing abnormal on the blood work. The next topic is drinking alcohol. So this person says, trying to stop drinking alcohol and painkillers. I know you're not a medical oncologist, but I know in our last webinar, I interviewed one who was talking about the Surgeon General, talking about how alcohol at certain stages can actually increase your risk. So that would be one reason to try to stop. But maybe this person's saying they don't know how to try, and maybe it's the depression driving them to feel they need to do this.
And just because you have cancer doesn't mean you can't have an addiction. And that's okay too. The number of people in this country who are overusing alcohol is tremendous.
So how do they stop, especially in the interest of not putting themselves at risk? Like addiction?
And it's okay to get specific help for that. You can go to AA. You can go for an evaluation at, your local hospital where they probably have some substance abuse counseling. Just because you have cancer doesn't mean you're exempt from things that are common in other people.
Right. And it's okay to accept that and then seek help for that. And it only adds another layer of why it's okay to ask for that help. This person says, I have anxiety and sadness about how my life and plans have had to change. What are coping strategies do you have? Because right now they seem elusive at the moment.
Yes. I think, this is, again, people often ask me about my clinical practice and that I must see people who are, quote, crazy all day. And I will often say, if crazy is that anybody who's living their life and driving down the highway, doing what they do and gets a call, which changes everything, is crazy, count me in.
Right.
So, having your plans abruptly changed and having no say in the matter is a lot to deal with. And
Absolutely.
you are absolutely entitled to feel upset about that. And I think one strategy is, after the dust settles, when an oncologist once said to me, when cancer is initially diagnosed, your life has to meticulously revolve around the treatment. Treatment has to start, often immediately, and the regimen has to be strictly followed. And when cancer, if it unfortunately returns, that can be sometimes modified a bit, where your, treatment can, sometimes revolve around, your life. But especially at the beginning of treatment, you have to stop what you're doing. Cancer doesn't care if your kid's getting married next week.
Right.
It doesn't care that you just were made the CFO of your company, or that
Right.
you just had a baby or were pregnant, or in the middle of a pregnancy.
Well, and talking about timing, this person says, I lost my sister to breast cancer 6 months before my own diagnosis. I have friends who tell me I need to stay positive. I mean, really, when you've seen that you've lost your sister 6 months prior and you talk about timing,
Yeah.
that's not easy to do. So what can this person, I mean, every case is different. Now, I
Well,
guess
there's
if
a
I was
fear,
talking to
but
her, and
there's fear, but there is also grief. Is grief is grief. Whether you lost your sister, to a traumatic accident or to breast cancer, you are still grieving the loss of, I always say sibling loss is a special case because they share 50% of your DNA and all of your childhood.
well, and then it puts that extra fear of
Yes,
it's incredibly close to home,
it's
and yet you need the strength to fight. So what would you tell this person?
to do both, but you're allowed to grieve and be strong and cry and try. So that's a motto I use often. You can cry as long as you try.
As
So,
long as you try.
yeah.
Okay, I'm going to give you a few questions wrapped in one because they're all kind of grouped. This person has fear of recurrence, says, I don't want to live with this daily fear. I want to erase it from my mind, and how? And this other person says, how do I not wonder that every pain is cancer?
I'll start with the second part. How do you not wonder that every pain is cancer? Ask your medical provider, and they will often tell you they'll often give you sort of a guideline for what's cancer, what's not cancer, that they can't definitively tell you, but oftentimes it will be, if it's a pain that persists for X number of days or weeks, then come see me. If it's a pain that comes and goes. So ask for details. They may say, if anything hurts, just, send a my chart message, but it's okay to be more specific.
And keep a log, maybe. I mean, I'm sure maybe there's an app for that. I don't know. I'm old school and I keep a little note on my notes section of my iPhone.
Right.
And if I see something repeat itself, then I'm like, maybe I need to talk to the doctor.
And you're not bothering anyone by asking for reassurance. This is a diagnosis that has many different outcomes. So, finding a provider who will answer those questions and provide some basis, some guideline to you of when to worry, or, who will say, let's move up your scans or let's move up your appointment if this is going on.
And I communicate in the portal a lot. And I
Yes.
mean, I'm sure, I know that's very hard for doctors because we hit you guys with so many portal messages, but I try to put it in like 3 bullet points and say, I'm
Yes.
having this fear, this, and, I just try to let them know so they can, I have my trust in them, which is good. So they can tell me okay, this is a problem. We should look into this.
Mhm. And fear of recurrence is, there are a lot of variations on that. So having some fear of recurrence, yes, but having a fear of recurrence that causes you not to be able to participate in your daily activities that make you happy, that overtakes you, that prevents you from feeling joy from things that usually bring you joy, that wakes you up in the middle of the night, that, prevents you from falling asleep, that, is treatable and can be treatable. And some of that is, with therapy. Sometimes it's with a combination of therapy and medication. And sometimes it's working with a specialist to sort of get at, what are you really worried about?
I'm listening to this, but I have more questions, and these are all tied to intimacy because I'm trying to get through them because I know your time is valuable. How do you, okay, these are two. One, we need to talk about sex. My self-esteem has taken a significant toll since my partner started feeling more distant. I'm bald, puffy from steroids, I have scars and pain and anxiety. I don't recognize myself anymore, but apparently neither does he. My husband and I went through this too. And then the other person, how do you start intimacy again after treatment? I'm a loss, to be honest, at the moment. And other people who are talking about that they're sad post-treatment. So how do you handle the large amounts of problems with my marriage? So you see this common denominator of sexual health, intimacy, marital problems. And it's not just like, oh, well, this girl's complaining because she just wants to have sex. No, it impacts everything. And
Yes.
then your marriage, and then could impact if you stay together, or your health insurance. It could impact a lot.
What any kind of cancer diagnosis does is, most couples who've been together long term develop what we call their sexual script, meaning, it's on Saturday nights, or, it's in the morning, it's in the evening, or I do this to you, you do this to me, we do this together, and we go to sleep. Whatever your sexual script is, when you have a medical issue of any kind, you have to rewrite the sexual script. And sometimes you have to go back to basics, which is just bonding around something that is not medically related. It's really just building the bond, and which can lead to other forms of intimacy that maybe aren't as exciting, like holding hands and hugging. Sometimes when your body feels so damaged and has been so poked and prodded, you don't want anyone touching you at all.
Well, and then if you've had your husband see your breast with like no nipples, packing wounds, holes, where you've had the surgery and bandages, it's not exactly sexy. And then you worry about, is it that they can't get this thought out of their head, or this image? And so you're trying to fix you, I'm trying to just work on my mental health and physical body. And I feel what these people are saying, but you can't fix or help them unsee what they've seen. Mm-hmm. So what do you say to that?
I say it takes time, and it takes a rewriting, and maybe your breasts were a huge part of your intimate relationship. And we often don't talk about that, that breasts and nipples are erogenous zones. It's part of what turns women on and men. And so to not have those parts means that you have a loss of sensation, a loss of function in many ways. And, for many women, they cannot, even if they've retained their breasts with surgery, their breasts are the enemy. Their breasts are, quote, what's going to kill them. So, part of that is going really slow. Part of it's talking about it. Part of it is calling out the elephant in the room.
Yeah.
And as I mentioned before, lingerie can be helpful. Another thing that can be helpful, and it sounds really simple, is changing the time of day. Because for many patients on treatment or post-treatment, there is an enormous amount of exhaustion that is there. And so there are so many barriers to overcome. Right. So many. But, being able to just reestablish that and oftentimes men may have that, or your female partners, whoever your partner is, may have a conception of, yes, they saw you healing, they saw the drains, they changed the drains, they did all of those things. But, partners have also witnessed childbirth.
Yeah, but you hear cases of that too, where men are like, they're not turned on after that either. So that's where I was like, oh, it started with the childbirth.
Right.
Because we're running out of time, and I know I said I would get to all of them, but I'm going to wrap up a few as our last one because I'm just going to list them all. People saying they're dealing with fatigue, and I'm going to say that for me, I've had to make myself go out and walk and exercise, but they want to know about anger management, anxiety, helping my partner and children through this situation. Let's see, a lot of it has to be on the anger management or just because it's easy to get mad. And then another person was saying, I'm at the point where I don't want to leave my house some days. How do I handle that?
Everybody is going to have a certain amount of mad, sad, glad. Um, I will also say the G word, which is gratitude, which I often say, you're having all these negative emotions in the world and Instagram, and your friends are just telling you to be grateful for what you have. So
Right.
I'm here to tell you there's a time and a place for that, but it doesn't have to be right now. So
Like their biggest problem may be if they got their beach house. And I'm like, listen,
Yeah.
I'm not even going to compare my problems to you. So
Yes. And you're entitled to feel all the feels, because anyone who is dealing with something hard is entitled to feel all of this. And this is any kind of a loss in your life, whether you're grieving a marriage that, has dissipated and ends in divorce, or you're managing a death of a loved one, a loss of a job. And this cancer is all encompassing. So having all of those, and sometimes you have them all in one day. You can be glad, mad, sad, grateful, happy, all of it. So really, it's the degree to which it is disrupting your daily life. It's the degree to which all of these emotions are getting in the way for you, getting in the way of you being able to perhaps do your job, get out of bed, function, go out of the house. And fatigue is, also a sign. Fatigue can be psychological, but fatigue can also be real, and it can also be treated. So I want people to remember that if fatigue is a major issue, there are treatments for that. If you find that these emotional states are all encompassing and preventing you from engaging in any of your daily activities, if they're preventing you from eating, from sleeping, of feeling hopeful, that is the time to get some help. Ask for help. Ask your oncologist. No one should be feeling, if you are having feelings of suicide or hopelessness, there's a national hotline, 988. And that's not just, a lot of times people think that because it's a cancer related situation, it's somehow different. Cancer may just be the situation that prompted it.
Catalyst was to get you there.
Yeah. Anyone who needs help, to please reach out for help.
Yeah. And I'm going to end with this last thing because this is a horrible situation someone posted about. But it's not unique, and it's not that I don't hear this from other people. They're talking about their spouse who sabotaged their mental health. I mentioned that, but they said during their double mastectomy, they said horrible things this whole time. Like, I'm already planning my life without you. Told her, I'm on long-term disability, and he's the only one earning an honest income. And said, maybe my cancer has come back. Basically, this person a spouse saying horrible things. Really, this person is angry at the situation. But lastly, let's just wrap this up to how do you handle, I know this is a loaded question, but how do you handle something like this?
Well, caregivers count. And I can't emphasize enough that this is happening to the patient, and it's also happening to the family system.
Yes.
And so finding a place where caregivers can speak freely, because oftentimes in this case, this person wanted to say those things out loud in front of their partner, but oftentimes people don't want to say that. They're scared to say that. They're scared to say what they're worried about. So getting caregiver support is incredibly important. You can get support together. You can get support as a family, but we must remember, making someone feel terrible is not defensible. I'm not saying that at all.
Right. No, but the fact that this person, I think, it's unacceptable, but they were so lost and angry.
Yes. And it's okay to say, I need you to get help for yourself because you're obviously really suffering. And caregivers and, they could be best friends. It doesn't even have to be somebody who you're
Right.
legally
And I'd
married
say
to.
what Dr. Weiss said earlier in the webinar is the number of people who will also get cancer later in life. People don't know when our story will become their story. So
Absolutely.
they have to realize that something like this could happen to them, and be delicate with how you treat everyone, because you could be needing the same help that we need tomorrow. So I'll leave it with that. Dr. Stephanie Ross, you are phenomenal. I can't wait. There's so many other topics, but I've kept you long enough. Thank you for joining us on the It's Okay Not to Be Okay webinar, and then doing this rapid fire with all the questions. Please send us, we will have the resources that you're listing for the show in our show notes, and ways that people can get in touch with you, and other, if they can access your office as well for care. And we're going to share, please share this episode. Everyone who's listening, leave a review, visit Armor for Life and breastcancer.org. And thank you for listening to Stage Free.
And thank you for trusting me with your questions and comments. I'm honored to be here.
I need a whole therapy session myself with you, but we'll do that another time. Have a great day, everybody. Want to make sure you never miss an episode of Stage Free? Subscribe, like, and give us a review. You can find us wherever you get your podcast.